welcome back to In Focus. And joining us now is In Focus health correspondent Lino Madu with more news on the swine flu epidemic.
Yes, indeed. Swine flu is all over the news everywhere. And the World Health Organization has raised its pandemic alert level for swine flu, signaling that the infection is spreading. In addition to Mexico, infections have been reported in the US, Europe, and Canada. Here's Voice of America's Rob Raffaeli.
The swine flu outbreak emerged in Mexico, where more than 100 people have died of the virus. Spain confirmed its first case Monday. A university student fell ill after returning from Mexico. The European Union's health commissioner, Andrula Vassiliou, recommended avoiding travel to the U.S. and Mexico.
How worried are you that this epidemic could turn into a pandemic?
No, I'm not worried at this stage. We have to wait and see and evaluate the situation.
The acting head of the U.S. Centers for Disease Control and Prevention said the EU recommendations are premature. But Dr. Richard Besser says the health agency recommends against non-essential travel to Mexico. He says only one person in the U.S. has been hospitalized.
Thankfully, so far, we've not seen severe disease in this country, as has been reported in Mexico.
In Washington, President Barack Obama said U.S. officials are closely monitoring the situation.
This is obviously a cause for concern and requires a heightened state of alert. But it's not a cause for alarm.
The Obama administration has declared a public health emergency. That allows authorities to release stockpiles of antiviral medication. Homeland Security Chief Janet Napolitano.
We have 50 million treatment courses of antiviral drugs, Tamiflu and Relenza, in the Strategic National Stockpile. We are releasing 25% of those courses.
Health officials say the unusual flu strain contains genetic material from pigs, birds, and humans. Authorities say none of the U.S. patients had any contact with pigs. Swine flu cases have ranged from mild infections to severe and eventually fatal pneumonia. Robert Raffel, VOA News.
Health officials are urging people to wash their hands frequently and be on the alert for flu-like symptoms. Voice of America's Carol Pearson has that story.
In Mexico, soldiers give away face masks. A new swine flu has spread through Mexico and to visitors from the United States, Canada, and Spain. The World Health Organization has raised the pandemic alert level. The organization's Dr. Keiji Fukuda.
What this can really be interpreted as is a significant step towards pandemic influenza, but also it is a phase which says that we are not there yet.
Mexican doctor Frank Rosengas says the new classification means the virus can spread from person to person.
Patients have the possibility of infecting one another from one day before you get the symptoms to 7 days after you get the symptoms.
Swine flu normally infects pigs, but this virus is a new strain.
These are a new swine influenza virus. They're new for pigs and they are new for people.
The symptoms are fever, headache, muscle ache, and fatigue. Other symptoms can include nausea, vomiting, and diarrhea. The World Health Organization says a pandemic is not a certainty, but human beings have not developed resistance to this new virus. International precautions are already in place. Many countries are screening passengers who arrive from Mexico or parts of the U.S. Schools in the U.S. where students came down with the flu have been sanitized.
And this is obviously a cause for concern and requires a heightened state of alert.
The Obama administration declared a public health emergency after 40 cases of swine flu were confirmed. One measure includes taking 12 million doses of Tamiflu from federal stockpiles and delivering them to the states. There is no vaccine to prevent this particular flu, but it responds to drugs like Tamiflu and Relenza. Health experts are trying to find out why cases outside Mexico are relatively mild, while in Mexico, those who have died are young adults, normally the most likely to fight off the disease. Meanwhile, the Mexican government has closed restaurants and even churches. Carol Pearson, VOA News.
Let's get more on swine flu from the global perspective. And joining us from Geneva, Switzerland is Timothy O'Leary with the World Health Organization. Mr. O'Leary, welcome to the program.
Thank you for having me.
Listen, not long ago, the world had to worry about bird flu. Now there is this outbreak of swine flu. Where is this coming from? What do we know in terms of the origin of this virus?
Well, as the name implies, it appears to have originated with some pigs in Mexico. There are lots of different viruses that human beings get, that pigs get, that birds get. What gets really worrying is when a virus jumps the species barrier, say from a bird or a pig to a human being, and then the same virus starts to pass between human beings. That's when we really start to get worried, because human beings don't have the same defenses to such viruses as animals and birds would have. Unfortunately, we see in the case of the swine flu that this virus did originate with swine. Now it is passing between human beings. So we're legitimately very worried about it. No reason to be alarmed yet, but it is preoccupying.
Now, WHO lifted its pandemic alert from a phase 3 to a phase 4 on a phase 6 level. Are we quickly moving toward a global pandemic?
Well, the raising the level from three to 4, there is a possibility that we would see WHO raising the level yet again to stage 5. We haven't reached this point yet, but it is possible. I mean, the big criterion for raising to 5 would be that there would have to be some kind of sustained transmission of the disease in another country between people. Now, of course, we've seen what we call community-level outbreaks in Mexico and the USA and Canada, and the disease has appeared also in the United Kingdom and in Spain. But those people were travelers who were infected, presumably in North America, and traveled back to their home countries and then became sick. So I don't think you would see the WHO, the World Health Organization, raising the pandemic level to 5 unless we began to see a sustained transmission of the swine flu from person to person in another country like the UK or Spain or elsewhere. We just have to watch and see. Of course, it's always possible that we could go back in the other direction and lower the alert level, but we're just watching it very, very, very carefully, and everything that we do will be based on the evidence.
Thank you so much for joining us. Unfortunately, that's all the time we have, and we will follow closely on the development on this issue. Thank you.
You're welcome. Bye.
Bye. And that's it. I mean, nothing has been reported yet for Africa, but we will be watching closely.
We hope nothing gets reported.
Absolutely.
Nothing gets there.
Yeah.
That would be nice.
Well, thank you so much,
Sure.
Lino Madu.
You're
Please
welcome.
be sure to join Lino Madu here on In Focus every Tuesday and Thursday.
And for more information on all these stories, go to voanews.com.